Here we are today to do a second round of MultiFrax treatment for Lillian. Lillian would like some improvement in skin texture, skin tone. She had one round of the MultiFrax treatment 1 month prior. Here we have numbing cream on her face that sat for about 40 minutes, and we're getting ready to do our second round of treatment. So here we're going to take off the excess numbing cream. Very good to have numbing cream sitting on the skin for an adequate amount of time. So very important to tell your doctor whether you have any allergies to common ingredients such as lidocaine or benzocaine. And then we always do a sufficient amount of numbing cream for a sufficient amount of time to make sure that your treatment is as comfortable as possible. So the very first time that we had done the treatment, depending on the Fitzpatrick type of the patient, we tend to do a gentle treatment for the very first round so that we have a good understanding of what the skin can and cannot take. There is always a risk of hyperpigmentation or burns or some unwanted side effect or complication from light-based energy, which is why it's particularly important to start off with a round of the lighter settings to understand what the skin can truly tolerate. So after taking off all of the numbing cream, I just prepare the skin with an alcohol pad to make sure that no residue of the numbing remains. And here we're careful to get off every last little bit. And then here we apply stickers to protect the patient's eyes from the laser. Though typically we're working outside of the paraorbital area with a very minimal risk to ocular damage. First, we're just going to start off around the face. The MultiFrax typically will take multiple passes, and depending on the skin tone, we're able to see erythema and reddening in the path of the laser exactly as when we're doing it. You ready, Lillian? Okay, so we're going to start right around this area. How does that feel? Good, it's okay. It's okay, okay. And we just follow along the contour of the face. And then as we can tell on her fair and reactive skin, we can already see the path of the laser come up with these tiny little rows generating microcolumns of heat. And in a little bit, these areas will become more edematous and more red, which is the exact clinical outcome we're trying to achieve. The MultiFrax is a very good treatment modality for patients who want a little extra glow in their complexion, but don't want the extra downtime that can be associated with a traditional completely resurfacing type of laser such as a CO2 or erbium. There is expected downtime after the MultiFrax. Typically for a couple of days we will have a little redness, we will have a little edema, and then typically the skin feels a little sandpapery, but you are allowed to wear makeup, you have to wear SPF, and you can go about your regular daily activities. MultiFrax is a very good gentle modality for slowly improving texture over time. It is really good for the busy individual who wants to have treatments but be ready to go back to work immediately after and not have significant downtime, usually associated with a traditional CO2 or erbium laser. The best results will come over time, over multiple sessions. Very good in the modern lifestyle where all of us are so busy and so on the go all of the time. Very easy to work into a lunchtime session or an afternoon session. MultiFrax is typically done in sessions of at least 3 treatments, 1 month apart. The 1550 nanometer wavelength helps build collagen, and the 1927 wavelength helps improve surface pigmentation. It is expected that the best results will come 3 to 5 months after finishing the last round of treatment. Before treatment, you should tell your doctor any medical conditions that you might have, any medications that you're taking, any ingredients you might be sensitive to, and of course, any allergies. If you have a history of cold sores, it is typical to pre-treat with antivirals before and after laser treatment. And if you have any history of recent Botox, recent fillers, and of course any suspicious lesions on the face that might be concerning for cancerous lesions, that should be known as well. And so here we have accomplished a full face of treatment. As we can see now, we have a very even amount of edema and erythema, and that will be expected to worsen a little bit over time. And then within a couple of days, we'll have the sandpaper texture. You want to let the sandpaper texture slough off by itself. You don't want to go in with any aggressive scrubs or acids to try to make it come off before it's ready. You want to just let it naturally happen. So now we have finished a treatment on Lydian. As you can see, here we have a very even erythema, edema that is expected to become a little more prominent over the next couple of hours, over the next day or so. Before the sandpaper texture set in, I have applied SPF for her so that she can be fully protected when she goes out into the sun. And then over the next couple of days, we'll see how she does, and then we'll come back for round 3.